now I would like to introduce our moderator here, Niles Freeman, who's president of our alumni board. And he's the creator of this series. Niles is a government innovation leader, strategist, and founding executive advisor at Star Insights, where he specializes in creating and growing business and core functions within organizations. Over the last 15 years, Niles' work has emphasized innovation, technology strategy, and digital transformation across the public sector. So without further ado, Niles, it's all yours.
All right. Well, thank you, Andy. And it's great to see everyone. We've got an amazing hour session for you all. We want to keep it pretty interactive, but we have an amazing group of panelists that represent the Rollins School of Public Health. We have a department chair. We have two amazing professors that are doing some very innovative research around public health and tech. And then we also have leadership from Emory, the broader Emory community that's really doing some pioneering work through the hatchery and thinking about tech and innovation through the lens of students and new ideas and startups and just a host of really exciting areas of focus that really connect back to tech. We want to do some intros and we'll dive into some of the questions that we have for the panelists, but just want to quickly frame this series as really meant to bring a level of visibility and ideas around the intersection of tech, innovation, and public health. What does that look like? What does that mean? When we started this series, this was about 2 years ago. We're in a very different environment today, and the importance of tech and the impact of tech, I think, is going to be more significant in the years to come as we start to think about changes in budget, changes in staffing model, changes in how research is deployed. So we just thought this is a really timely topic. And as Andy mentioned, we're going to record it so that more people can sort of get insight from the conversation today. But we also think there's going to be potentially follow-up sessions that go a little deeper into some of these areas because we think the demand and the interest that we're getting around this series is just continuing to grow. So for today, we want to focus on a couple of key areas. One, we'll talk about research that's being done across Rollins with respect to the Health Policy Management Department, as well as global health. Tons of really exciting developments and ideas and ways that you all can think as alum or students about what that means for you individually in your current role, maybe thinking about a different trajectory for your work, but also creating a network and sort of a coalition of folks that sort of speak like-minded about tech and its influence on research. In addition, we'll talk about some of the broader tech movements, and this is where Ben Garrett from the Hatchery and Dr. Stephen Patrick can also speak to some of the work that they've been doing around civic tech and what does tech mean for government? What does that mean for departments of public health? So many areas of interest that we can really get into today. But before we do that, I would love to just ground us all and have folks give a bit of an intro. Ben, if you want to kick us off and just give us a little bit more of your background and the work the Hatchery is doing, and then we'll dive into some of the questions.
Awesome. Thanks, Niles, and thanks everyone for being here. So I'm Ben Garrett. I'm the director of the Hatchery, which is Emory Center for Innovation. We work with Emory students from all the schools that make up Emory, graduate and undergraduate. We help them to start companies and nonprofit organizations. And we also work with students as they're building entrepreneurial skills, kind of regardless of whether they want to start a venture or not. My background before Emory, I was working at social impact accelerators, so working with startups globally who were trying to have some kind of social impact. And then before that, I worked at a bunch of startup nonprofits. And so, yeah, this intersection of entrepreneurship, technology, and having some kind of positive impact on the world is very near and dear to me. So really excited to be with you all today.
Very good. Thanks, Ben. Ilana, would you like to go next?
Sure. I'm Ilana Gretz. I'm a faculty in health policy and management, and I've been studying health IT for a long time since I started my PhD. And I also direct our doctorate program, and I have a class that I teach on health information technology for the master's program.
Good. Great to have you with us. Jithan, love to hear about your background. Yeah.
Thank you to the Advancement and Alumni Engagement Office and Niles for putting together this panel. So I'm faculty of global health, and my background is in engineering, nutrition, and life course epidemiology. So my research focuses on diabetes and hypertension surveillance, with a focus on how to integrate precision medicine for public health. So I also lead this initiative called the Diabetes Translational Accelerator, which is a platform to encourage entrepreneurship and startup engagement at Emory, with a focus on diabetes and its complications. Thank you for having me and look forward to the discussion.
Very good. Last but not least, Dr. Stephen Patrick. Yeah.
Hey, thanks, Niles, and thanks for putting on this webinar. So I'm Stephen Patrick. I'm the chair of health policy and management, and I'm a practicing newborn intensivist at Children's Healthcare of Atlanta as well. As I think about health, IT, information technology, and other things like that, technology in general, the two things I think are relevant are, one, just in my daily practice, and some of the, I guess I don't practice daily, but in my clinical practice, and some of the tools that our team has worked to help inform decisions making at the bedside. Two, some of my previous roles as a senior policy advisor at the White House, thinking about how states can integrate data. And I think this is some of the earlier conversations now I've had around this. Where can we really see data innovations occur, and how can even non-governmental groups be a part of helping? So look forward to the conversation today.
Very good. And I just even hearing the backgrounds, when we talked ahead of this call, obviously, but the ability to think about research, startups, nonprofits, being an entrepreneur, right? Being a professor, public health. I mean, it's like there's so many elements just on this call alone, and you can start to see the intersection, which is really exciting. So kind of with that in mind, Stephen Patrick, I'd love to hear just a little bit more broadly about how Rollins is thinking about, research, but programs and the influence of technology or healthcare IT that you're seeing, and is something that you guys are really focusing in on.
But Dr. Gratz will talk a little bit about her work, which I think is some of the, in our Department of Health Policy and Management, I think she does the most work that is focused on technology, across kind of where I think, where we see lots of opportunities are across with the health system. So within HPM and at Rollins, we have a health services research center that is a partnership between Rollins and the School of Medicine, and including a partnership with Emory Digital and the health system here. So I think there's a lot of ways where we think about data use and using a learning health system. How can we be a part of improving outcomes using these data that are here, building interventions within? So that's certainly an element of that. And I think the other thing that we've been thinking a lot about, we've seen, several data sources removed that were public before. Are there ways where we can step in as a community to fill in some of those gaps? It's kind of getting at this, the greater good for data and how we use data, and how can we, in this challenging time for public health, be a resource for communities for public health. That's part of what we're thinking too. And so I think as much as we can think broadly about collaborations across campus in Atlanta and beyond, that's where we want to be able to fill in some of these gaps and really be a conduit for public health in unique ways.
Yeah, I love that. And I mean, I think this was true. I don't know if I mentioned, but I'm a 98 graduate of Rollins in the Health Policy Management Department. And I remember this even quite a few years ago. There was this emphasis on partnerships and coalitions. And, obviously Rollins has its own amazing reputation, but it was, how do you connect in with the Georgia Department of Health? How do you connect with tech companies in the greater Atlanta region? And it was just, remember, it was really embedded into how I thought about just my degree. So it's, just a quick question on this. I mean, how is the department thinking about partnerships? Like, is there a different way, with changes in research and funding? Is there a different way, or maybe things that you guys are starting to think about that might be of interest to folks on the call?
I think we're all catching our breath a little bit from the last 2 months. But along with that, I think, for the last year, we've been thinking about how health policy and management can be a core for expertise and analyses, thinking about data in different ways, and how we can partner kind of throughout. And so, yeah, we have some of those partners you're talking about, Niles, whether that is Medicaid, Georgia Department of Health, to communities like that. That's part of where we want to be. I think in this most recent phase, we're also thinking about how we can leverage the deep expertise of colleagues who've been recently let go from Health and Human Services, and how we can be a space where we can, perhaps be a place where folks can come and contribute, connect to our students, where we can build community around that, because we have in Atlanta, we have such an extraordinary community of incredible public health servants. And so for many of them that are, now thinking about what's next, I think part of our thinking is how can we be helpful to that community and to use that to advance public health worldwide.
I love that. Yeah. And it's kind of this dimension, right, of, use it on a practical level, right? Folks that maybe have recently been impacted by layoffs, but have this amazing level of expertise. And whether that's public health, healthcare, tech, you name it, how do you bring that collective thinking to the table and maybe redirect, repurpose? Is there a new way? Is there an idea you've had that maybe you just hadn't really put into execution? Maybe there's a way to become an entrepreneur or start a business. But what you're saying is, how do we connect that? How can Rollins, how can department leadership and professors really sort of thread the needle a bit to sort of connect that back? Yeah, I love that. Because you're going to have to think creatively. It's a different environment now. Yeah.
I think creative thoughts. And I think the other thing that I think about for us is that we are we're a connector. We have deep expertise in the department, but I think we have a broad view of the world. And sometimes we can think about connections that I think may not be evident beyond because of the depth of knowledge of our faculty. And so wherever we can leverage that to be broadly helpful to public health, that's where we want to be.
Absolutely. Well, that's a great segue into, I know we want to go a little deeper into some of the amazing work that two professors within HPM, Health Policy Management, Global Health, are focused in on. Ilana, I'd love to hear a little bit more about your portfolio. It sounds like you bring a ton of expertise around healthcare IT, data, and what you're focused on today.
Sure. So from the start of my career, like before I started my PhD, I was always interested in technology. And so my dissertation was focused around Kaiser Permanente's implementation of Epic, like back in 2006 is when it started. And then moving to focusing more on like patient-facing tools like patient portals, telehealth, video visits. And then today, a lot of my research focuses around remote monitoring, and particularly like from different devices. And I'm very interested in like devices that can help support medication adherence. A lot of my research is in cancer, and more cancer treatments are being approved for like oral therapies as opposed to, IV chemotherapies. And they are very expensive. They have very complicated schedules, and they have, can cause a lot of severe symptoms that patients need to manage. And when they're doing it from home, I think they can use more support. And so I have partnered with a lot of startup companies that have developed innovative solutions that I've been testing. And I have different trials like in the cancer space that I'm looking at. And then I still collaborate with Kaiser and at Emory to study telehealth and video visits and remote monitoring and how that impacts access to care, patient outcomes, and things like that.
That's amazing. And I mean, it sounds like, your background to be able to see like Epic at that level, right? And those large IT infrastructure projects down to how can startups engage in research. I was curious your perspective on how you've seen startups plug in. Like, what is the best way for startups to plug into a broader research agenda? Because you're always going to have large IT firms and large IT projects, but I specialize in this space around startups as well, because I just think there's such an interesting, unique value add that they can bring. But how have you seen that play out in your work?
I think recently there's been just a huge boom in innovation from third-party apps, because part of the 21st Century Cures Act, just passed a few years ago, is to force EHR companies, like big EHR companies like Epic, to allow their data to be shareable and to work with third-party apps. And so I feel like there's a lot of innovation in that space where companies like, startups and not startups, like Dexcom is working to build a platform that's integrated with Epic, and like other startups that I've worked with that have these devices that can support remote monitoring of adherence, that can plug in and make the data usable for clinical care. And I think that is sort of the future, because in trying to research and implement any kind of solutions in healthcare and getting clinicians to pay attention. I feel like if it's not integrated within the EHR system, it's really hard to get them to look. And so I think this is really a game changer for health delivery. So I think there's a lot of innovation there. So making sure that you are working within these systems, and Epic is the biggest one. So I think if you're going to start anywhere, like building something that is compatible, that can integrate into Epic is a good place to start.
Good place to start. Yeah, 100%. Yeah, because you want to, it's almost, where do you plug in with your idea and your solution, given the landscape of IT, right? I think the other component too, I've noticed this primarily in the public sector, is where startups are brought into government agencies because a leader might be thinking, hey, I want to do something, I've got a broader vision of what I want to accomplish, but I want to get an MVP. I want to get an early prototype of something in 3, maybe 6 months. And then it gives them that opportunity to collaborate with the startup and do that in an environment where you can pressure test what is actually being created. Are you seeing that same sort of dimension within research, like where you have a vision for what you want to do ultimately over multiple years, but maybe a startup can play a role to sort of get an early MVP of something off the ground, or pressure test proof of concept, maybe a hypothesis you have?
Yeah, I mean, I think startups have a huge role in that, because I think they are more nimble and they can like start small and test different things. Like one of the startups that I'm working with now, they developed a very cheap technology using NFC labels, which are like near field communication, like your Apple phone. You can tap your phone and you stick the labels to any medication you take, and the labels are linked to the exact medication schedule for that medication. So you can have like 3 different treatments that you're taking, and you put a label on each one and then tap it to track your use. And I feel like a small company can do something like that, test it in small pilot trials. And they've had like several small pilot trials, including one that we did here at OneChip, before scaling and integrating with Epic and getting bigger. So yeah, lots of opportunity.
Well, one of the things, I don't know if I mentioned this at the beginning, but this is being recorded and we'll send a summary coming out of this. But I'd love to even share with the audience even some of these specific examples that you're talking about. They're just fascinating. I mean, I remember some of the early work I did in Africa around health system strengthening. This is 20 years ago. We were talking about how to improve adherence and awareness around HIV and AIDS treatment, and we were using flip phones. So like, just to see how it's progressed in the last 20 years, but it's really empowering. It's really inspiring. And so, we can talk more about what to share. But thank you for that overview. Jithan, I know you have done a ton of work, obviously, in the diabetes space, and I know you have also a real passion around startups and incubators and accelerators. So we'd love to hear a little bit more about your work in global health.
Thank you, Niles. So my research focuses on non-communicable disease surveillance. And this is especially important because of 2 reasons. First is that participation in surveys have been decreasing over time. So the latest round of Enhance is less than like 40% participation. And funding for cohort studies is also decreasing. So it's important to identify alternatives to surveys and cohort studies for those of us in public health. And this is where I feel technology can play like a really big role. So Dr. Patrick also highlighted this. So it's important to consider non-traditional data sources like electronic health records. So for instance, what we are doing is we're studying metabolic monitoring among people with serious mental illness using a large EHR database called Epic Cosmos among this population who is typically underrepresented in surveys. The other thing that we also try to do is we work with startups. For instance, we work with Dr. Lance Waller's team in Biostats at Rollins. We generated the first ever estimates of hypertension prevalence using objective blood pressure measures at the county level. This is from health kiosks, which enable remote voluntary monitoring. And as I speak more, those who are attending can see there are a lot of synergies to expand and collaborate with the faculty here, especially across departments, and also trying to figure out how do we work with people who are working across different areas of expertise. So be it Dr. Stephen Patrick or Dr. Grades or Dr. Victoria Phillips, like trying to work across departments, I think becomes more and more important. So the other area, like you mentioned, was about startups. So we can identify these care gaps, we can identify potential for solving them, but technology, I feel, can really address some of these gaps, not all of them, some of them. So this is what we're attempting through the Diabetes Translational Accelerator. So for instance, we worked with India's leading diabetes experts to identify the top 10 problems that can be solved using technology within the next 10 years. So we're doing the same thing with faculty and health practitioners from rural Georgia in June. So we encourage those of you who are interested and who are interested in building startups to check out stopncd.org. We just launched it this week, whenever you get a chance. So these problems, we hope, will inform course projects at Emory and with our partners at Georgia Tech, and also fellowships that can support PhD students to convert their dissertation into a startup. So that's something which we are really passionate about.
That's amazing. I don't know if I knew this, but for the work that you just described, is that very specific to students? But are there ways that you can bring in alumni into, I don't know, whether it's through the lens of the startups, or is there, I don't know, how do you look at alumni in the context of some of that work? Or how could alumni play a role? Yeah.
Alumni bring like such a deep expertise given their immersion in different fields. So we encourage alumni to look at these problems, see if there are areas of synergy with faculty here. And as part of the Diabetes Center, we're happy to facilitate collaboration. So we are like a 180% strong center. So we will have people who are interested in something related to diabetes that the alumni may also be interested in. And diabetes as a disease literally affects almost every organ system in your body. So even those of you who are not interested in diabetes specifically, but are interested in heart disease or kidney disease or cancer, can always find ways to work together.
Maybe that's a good next step. We can talk about that, right? Because we see with the alumni board and just a lot of the work that we do with alumni, there's just this amazing depth of expertise. And then you have, as Dr. Stephen Patrick mentioned at the beginning, like if you have folks that have been recently laid off, unfortunately, but they have an amazing level of idea and expertise, like how can we channel that? Like, is there a way to make that connection, maybe more informally or formally? So I love that. Great. And then Ben, I'd love to, I think this is kind of tying in nicely with all the work that the Hatchery does. Obviously you guys have a primary focus with students, but we'd love to hear about, as you think about students and their ideas and what they're bringing forward. I mean, you guys work across the entire Emory community, so all schools. But even with that, what are you seeing with respect to a focus around tech, but I think in the context, public health and healthcare? And I know you've talked to me about, you've had some folks from Rollins, but you've also had folks from the business school that have an interest in healthcare and public health. So we'd love to hear a little bit more about what Hatchery's doing.
Sure. So I think maybe I'll talk a little bit about kind of like how the Hatchery talks about technology, and then I talk a little bit about like what students are doing with technology with their startup. So from the Hatchery's perspective, one of the things that we say to our students very early on in our programs is that like we've reached a state of technological development where our species can do just crazy, insane things and do them very, very quickly. And so the question, like, can we do this or not, is not so important of a question. The question is more so, should we do this or not? And so we really want to encourage our students to be like values-driven leaders and to really think through, why do you want to make this solution? What problem do you really want to solve? And how do we make sure we're pursuing that like human problem, human need, as opposed to sort of creating cool technology for cool technology's sake. And so one of the things that we definitely, try to bring home to students is like, we want you to fall in love with problems, not solutions. And so find something that, really, irritates you, makes you mad, or a possible future that makes you really excited, and like really hone in on that. And then do what you need to do to make that happen. And don't like lead with the solution first. So that's kind of the Hatchery's approach to technology in terms of students. I mean, one thing that's so amazing that's not surprising is just the students are incredibly tech savvy, and also a lot of technology and the ability to develop things technologically has gotten much easier. So like every student we work with knows how to stand up a website. That wouldn't have been true like 10 or 15 years ago, probably. And oftentimes they can even, if they're doing some kind of like digital software product or service, they can at least do a prototype, sort of regardless of what their level of like engineering skills are. And that's really, really exciting. And the students are very eager actually to teach themselves how to do that. And they hit up ChatGPT and ask it questions about kind of filling in the gaps there. So that's really amazing. I think a big theme that we see for the way students are leveraging digital technology, especially and particularly in the healthcare space, is around accessibility and specifically like driving down the cost of different kinds of services so that more people can access those services. So an example of that, we have an MBA student. Her name's Kayla Thomas. She's started a company called DIY Doula. And it is an app that is for family members of people who are pregnant. And so the app sort of gives you basic like doula training so that you can offer that kind of care to your family member. And so again, making the services that can be somewhat expensive accessible to a much broader audience because the information can be shared very rapidly and very cheaply. Another example that comes to mind is we worked with a school of nursing student named Katie Karchner, and she was starting a company called Glassbox. And her like passion, the problem that she kind of fell in love with was people are not taking advantage of preventative care because it's too expensive or they're afraid it's going to be too expensive. And so in her research, she discovered that I think at the time was 80% of like EOBs from insurance companies are incorrect and incorrect in the more expensive direction. She trained an AI model to basically read your insurance information, read your EOB, and then identify errors. And even they offered to like call your provider or call your insurance company for you and advocate to get that corrected. And so again, it's making people less scared to go to the doctor because they know they're going to actually be able to use their insurance and get to better public health outcomes. So we see a lot of students who they're thinking about technology not because it's cool and shiny and trendy, but because it is a means to make different kinds of services or information more accessible, which is a lot of fun and really inspiring for me.
I just want to like lean on something that Ben said when he was talking, which is start with the problem, not the solution. I think that is such good advice in so many different places. It's true in research too. You know, sometimes I think when people are, the worst thing that somebody can say is like, I have this data set that I want to ask a question. Start with a question that you have, a problem in your space that really gets at you. And then it can lead to so many creative solutions. When you sort of start with a solution in mind, or you start with like, you really limit your ability to be creative. And I think part of research, part of innovating is really being bothered by a problem and to not be anchored into a solution and to sort of work through a series of years, multiple different solutions. I'll talk about like just briefly one for our team. I mean, our team does work, you know, the main group of research that my research team does is on the opioid crisis and its effect in pregnancy and early childhood. And so one of those problems we have is we don't really know which babies are going to develop drug withdrawal right after they're born or not. And our ability to detect who's going to develop withdrawal or not is poor. And in some cases, in some hospitals, only about 20% of infants who are exposed to opioids develop withdrawal. But we observe them in the hospital for 5 to 7 days, separating them from their mom and family sometimes. And so we started developing clinical risk prediction tools. And our most recent one, I was thinking about this with Alana, like we developed using Epic and published. I'll stick it in the chat if anybody's interested. So I think this gets at like there are multiple modalities to get at the problems. And generally in a theme, there are so many problems where you can start to tease out. And the more specific you get with the problems, generally, the more applicable the solution might be.
Oh, 100%. And I picked up on that same point, Stephen, when Ben was speaking, because it's so simple, but it's so poignant, right? And it connects with, I think, a lot of what's happening in sort of this broader, the terms are civic tech and gov tech, but this is a space primarily in the public sector where leaders are trying to think about tech in a different way, so that it's not about IT, it's not about the tech, it's about how tech is enabling service delivery, accessibility to services, all these dimensions that at the end of the day are very healthcare oriented and public health oriented as we start to think about that type of work. But it is, it's really foundational. And I think one of the ways that this has started, I've seen this in the public sector for quite a few years, this is probably 10, 15 years, is user-centered design, human-centered design, these approaches that almost force you to think about, well, what is the need of an individual? What is the need of a community before you start to even bring infrastructure or tech into the fold, right? Like really step back and figure out like, what is this pressure point? And those approaches really help to facilitate that. So I love this theme. Just then, or Alana, any thoughts on that with respect to your research?
In terms of like starting with the problem?
Yeah, or just kind of, how you guys have been thinking about your research and approaches you take and maybe recommendations you might have for folks on the call. Yeah.
I think starting with the problem and also like using your own experience and frustration, as I think Ben mentioned, like if it's a problem for you, it's going to be a problem for someone else. And just, I feel like you just gotta like start doing it, like start like investigating more and coming up with solutions and talking to people. But there's like so much technology, so much cheap technology, like the NFC labels, like those are super cheap, really easy to integrate, and just novel ways to use it to improve care.
Isn't that so important to know? I was going to say, because tech used to seem like it was more of a barrier, but tech has become so cheap relative, right? It's like, it's not a barrier anymore. Things are open source. There's a level of accessibility that's there. But I also think your point on just start is really important too, right? Because you could spend a year creating a portfolio of what you want to do, and that could be research oriented, that could be through the lens of a product or service. And sometimes if you have an idea, get out there and test it and just start and see how that builds upon itself. Yeah.
Yeah, and I'll say too, there is a digital divide. Like not everyone has equal access to broadband internet, but in terms of mobile phones, like phones are getting so cheap, and I think like 97% of like the adult population in the US have a smartphone or a mobile phone that can at least text. And so using that to connect with patients and improve care, I think is just a lot of opportunities there.
Niles is flip phone. We heard about it.
Flip phone. Let's go back.
So, and I really appreciated like where this discussion is heading, like because over the last like year and a half since we started the accelerator, we've spoken to like over 100 people across Emory, Georgia Tech, and our partners in global health sectors. And what we understood was, more often than not, engineers often work on very esoteric problems and like advancements which may not necessarily be applicable in the broader clinical landscape, while clinicians and public health practitioners have so many problems that they want to solve, but often have a barrier in terms of solving them. So the way that we were thinking about it was that people in public health are in a unique position in order to define and measure problems really well. So we are very good in terms of like understanding who the relevant stakeholders are. We're good at like understanding which data sets would be able to characterize which problems well. So combining our skills and like defining problems and like helping technologists co-develop solutions together, I feel that's where our real strength is, and that's where I feel Rollins is going to very soon take a leadership position. And to add to the other point about barriers and how technology has become more accessible that you brought up. So large language models have substantially reduced the barrier and friction to build software, especially fine-tuning them for specific use cases. So some of you who may not have enjoyed programming in SAS when you were at Rollins, you'll be able to build programs faster and better in languages that you were not familiar with it at all. And you can build tools to respond to the ever-changing needs, especially given that we're dealing with a different public health crisis every few years.
I love what you just said, and there was one point in particular which I've seen a lot in the public sector through the civic tech and gov tech movements, where you work with a government partner, and they want to create a solution or a product to serve the public, to serve the residents, to serve communities. What happens generally is you'll have really strong leadership that has a business orientation to it, but they don't bring in tech. They don't bring in the tech leaders or the data leaders or other leaders to say, hey, we've got this idea, like, can we start to co-create or even get some early ideas of like, I've got an idea, but how could tech enable that? And so what happens is they'll create an idea, they'll push an idea out, and then they start to engage the tech community. It's like, well, you need to consider these three things. So what you were saying, it really hits home for me in the sense of how do you bring both parties to the table from the beginning? Like, how do you get the business and the tech leaders in government? How do you get a researcher, a PhD, a professor, and bring those tech leaders to the table to help them think through, like, hey, I'm thinking about this vision. This is the agenda I have for the next, I don't know, 5-10 years. But how can tech be part of that conversation from the beginning? How do you guys think about that on more the research side? And then would also love to hear from Ben what he's seeing with respect to sort of the startup community.
So from the perspective of global health, it looks like there's like a substantial trend by governments to start building digital public infrastructure. So like platforms for health and banking, that's going to be substantially increasing across like Asia and Africa. All this is assuming that we're not heading towards a great power conflict or major supply chain disruptions in the immediate future. But the benefit of like these platforms is it enables us to plug and play different kinds of software, iterate very fast, and work towards solving big problems like climate change and chronic diseases.
Okay. Yeah, and again, the question is kind of more just, as you start to think about a research portfolio. Let's think about it through the lens of health policy and management. How would you recommend to bring in tech leaders, or how to bring in sort of subject matter experts that have sort of a tech vantage point to your research? Or is that something you've been doing? I know, Lenny, you've talked a lot about startups, or Dr. Patrick, just kind of your broader work as the department chair. Like, how do you guys think about bringing those audiences together? So from the beginning, you're getting that sort of advice or perspective from tech leaders or the broader tech community.
I mean, for me, I have a lot of research that's very focused on medication adherence. And so I feel like I try to know like who the players are that have tech solutions for measuring medication use and connect with them and like, think about like ways to leverage their specific technology for a specific need. So I feel like it depends on like think of the problem and then find the players that have technology that can help and talk to them and be in conversation with them. And I've found that like most companies that I approach, they're very willing to engage. I've had like companies that I work with, like speak in my classes and meet with students. They love working on research projects. And I think it's a huge benefit to them, right? If you can have a rigorous trial that shows some clinical benefit to their product, I think it just helps them grow and show their value. I think like start with the problem and then like start talking to the people that have potential solutions that you can engage with and start that early.
Yeah, I think for me, it's about, what's the question that we're working through and who needs to be at the table. I do think that more broadly, research in some communities and some elements happens in silos. And the further that we're going, like that's just not the way to do. First off, it's not as fun, but it's not the way to do work that's impactful. And so oftentimes I think about this as like a user first or a person with lived experience first. So from the patient's perspective, from a community member's perspective. So I would say like a lot of our research teams include people with lived experience, whether they're, a pregnant person with a history of opioid use disorder, whatever it is, like working through from that vantage point. And then this is a long-winded way to say that sometimes we bring in tech folks, but sometimes if I'm, from my standpoint, like probably a minority of my actual research is focused on technological. It's a lot of like more community, or it's about partnerships, but I actually think it applies to the same thing. Like, what's the problem we're trying to solve? Who is it affecting? Who are the key stakeholders, and who needs to be at the table? And how do we do that in a way that's collaborative, that is focused on the problem, and can be creative about the potential solutions?
Love it. No, that's great. And we're just kind of riffing here a little bit on this topic, and I know we want to get back to some a broader conversation about just the future of tech and what that looks like for you all. But Ben, I'd love to hear your thoughts, because I know you were doing a ton of work across Emory and really trying to cultivate this culture around innovation. But I know have done a lot of work with startups and the accelerator program over the last year. And, that has tentacles into beyond Emory, the city of Atlanta, and how, just the ecosystem in Atlanta and even broader across the US, I think really starts to think about this. So with the work with the accelerator recently, how do you see that being maybe even more applicable to public health and healthcare in the future?
Yeah, for sure. I think there's a couple of intersections, or a few intersections. So I think one is like, and Jithan already alluded to this. There's a real value in like the research in terms of like surfacing and validating problems, like for entrepreneurs. And so I think about students who they're in their classes and they find out about a public health problem through research that people have done, and that can be the spark for them of like, well, that's wrong. That shouldn't be happening. How do we fix that? And so sort of that surfacing of a problem, and then also even when a student has an idea that a problem might be there, being able to leverage existing research or partner with researchers to validate and understand that problem of, well, what am I seeing? Where is that coming from? Is it a symptom of the deeper problem? But really helping to like flesh out what the problem space is super crucial. And then I think also, and it sounds like Alana does a lot of this in her work too, is like leveraging the skill sets of researchers to validate solutions, and to do that really rigorously, and to really pay attention to what are both the positives of this solution, but then are there unintended consequences of this solution that as an entrepreneur, I did to think through and kind of incorporate. And one thing I'll name too is that those three things, that like problem identification, validation, and like solution validation, when you're commercializing intellectual property, those are called value inflection points. Like ideas are cheap. Anybody can have an idea. But those moments where that idea, like the problem gets validated, that idea like literally gets more monetarily valuable. People will invest more because that problem is real. And when that solution gets validated, people invest more because that solution has efficacy. And so it's both, yeah, that intersection of research and startups, it's really, really good for the startups. But then, yeah, researchers, you are doing something that is, you can literally put a price tag on in terms of like validating these different stages.
So what I'm hearing, Ben, is that we need to have an accelerator for Rollins in public health.
That's not my job, but I would be happy to see it.
I know. No, it's amazing. No, I mean, I love the way you're thinking about that, and it's a very practical application, right? It's strategic and lofty, but it's like, let's get into a level of validation that's going to support professors and students, and really thinking about the tactical elements of that. So I love it. Well, good. I'd love to open this up, kind of a broader question. I know we wanted to touch on for the group here. There's a lot of change happening, right? There's a ton of change on research, agendas, funding, individual teams, the CDC, USAID. I mean, there's so many elements we could speak about. I think a lot of us are, especially the participants on this call, are probably very directly connected to it. So I'd love to just hear thoughts from you all about, in the midst of a lot of change, and I think what Dr. Patrick mentioned, we don't know a lot as well. We can kind of see where this might progress, but there's probably more to come. And, how do you see tech and innovation playing such a huge role, or an influential role, in the future of public health and healthcare? And I know that's a big question, but would just love to get some thoughts as a group and maybe riff on that for a few minutes.
Well, there's a huge vacuum, right? And I think we're just getting a sense of where that is.
Mm-hmm.
So I think we've lost a depth of experience, but we've also lost data systems I think one of the things that folks may or may not appreciate is that, CDC in particular also supports state and local health departments. And sometimes they do that with personnel, sometimes they do that with data. We know that there are, just as an example, just boots on the ground, right? We're already seeing an inability to respond to, lead outbreaks in Wisconsin. We're now seeing data systems that are going away that, like PRAMS is a maternal child health data system, where CDC really kind of collected data, cleaned and sent it back to the states. Some state departments may have an ability to do some of that work, but many do not. So the ability for, like, if you're Massachusetts, you can do a lot of things. But if you're Alabama or Georgia or Tennessee, you don't have the resources to. So where can we think about stepping in? I think in some cases it's how can we partner and sort of fill in some of those just knowledge and personnel gaps. But I think there are real technology and data needs around, where can we step in to be a partner? One of the things I think folks may or may not appreciate is that most state systems, like the state data systems, don't talk to each other. And the state themselves doesn't actually have the ability to build the systems to do that. Some states have tried, some other, but in many cases, those systems don't talk to each other. So while you would think, Medicaid and education, like we can use these data to look at this, that really doesn't exist in most states. And so that was the even before our recent changes, now even just basic things. And so I think part of us is to sort of be listening. It can be overwhelming with this whole slew of things, but if there are 1, 2, or 3 things that we could do, pick off a thing that we might be able to do and do well, I think it could be really helpful.
I love that. Yeah. How about others? Yeah. Thoughts you have on it?
So I just want to reemphasize how important what Stephen had raised is. Now we're at a time where we have to rely more on alternative data sources like EHRs, electronic health records, community-based and personal health monitoring tools. So for instance, like working with startups. So if you're an alumni and you have startups which have collected a lot of data and you believe there is some application to surveillance, we highly encourage you to connect with the Rollins researchers who are working in that space to build supporting surveillance systems to the CDC. There are opportunities there which will really matter a lot in the long run. The other thing is, I feel with decreasing costs of personal health monitoring, we'll be soon seeing a time when precision medicine, which will personalize care for individuals, but it will also be integrated with public health, wherein you'll be seeing pockets of individuals who may respond better to certain drugs, and at the grander scale, aim for like a precision health policy kind of a perspective, where each state or each county may be able to tailor their policies or specific insurance programs for certain communities.
Yeah, it's a great point, right? Because there's I would imagine these hubs of, there's a depth of expertise maybe in certain states, right? Or local government or different entities outside of the CDC and some of the federal agencies that can be an amazing complement, right? So it's kind of like, where are they, right? Specifically, and you talked a lot about work in diabetes, what are the states that might have the most robust repositories of data? And then how do you think about how to fill that gap to what Dr. Patrick was saying? Yeah. Other thoughts, Elena or Ben? Yeah.
I think about like the funding that's being limited for research and how that affects policy. Like one policy that I'm really interested in is Medicare and Medicaid, since COVID, have been covering telehealth services pretty broadly, and they keep extending it like in 6 months increments. And right now they just expanded it it was supposed to end in March, and now it's going to end in September. But there's not really great evidence to really guide these policies. And now there's going to be even less funding to get that evidence to understand, like, is this valuable? Like, in what situations should we fund telehealth? Is it going to be cost saving? And, what are the consequences if we just cut off this funding, right? Like, who's going to completely lose access to healthcare? I'm thinking about like, how can we keep producing this kind of evidence when funding for research is so limited?
Yeah.
Soma has a really interesting question in the chat. too, about how do we prioritize some of the problems that we're facing here. I'd be curious to I think that's really interesting because it can be really overwhelming. Like back to the point, like we can't do everything. And sometimes that itself can be paralyzing. One thing I'm thinking about is just like, it's almost like a 2x2 table of sorts. Like as you sort of think about quadrants, like what things are like high, like impact a lot of people and are kind of easy to do, as opposed to impact fewer people and hard to do, right? I mean, some sort of basic weighting I think is important, but I do think this sort of like we could catalog all the things that are going on right now, but in some sense, like just picking a thing that you want to, what problem, back to Ben's, what really irritates you, go after it. And really go after it. Better to go, this is my 2 cents, better to go after a problem deeply than, 5 problems in a shallow way.
Absolutely agree with that, right? Choose a few, go deep, prove it, build it, right? That is momentum. And then you're gonna learn so much from that approach that you can then apply it to so many other areas, right? And I just love the simplicity of like a 2x2. Just how do we map that out? Sorry, go ahead, Jithan. Yeah.
Oh, yeah. So this is something which, so what Sriyasha was like mentioning is something which we have been reckoning with for the last like 6 months or so as we're working on these problem discovery workshops. So we sort of operating it similar to like how frequent is a problem, how intense is it for somebody to go through it, how long does it last, and finally, would somebody pay to solve the problem? Because at the end of it, we need sustainable solutions. So we don't know who the payer is, but would somebody be finally willing to pay for it, the solution?
Well, and I would just add to that too. I think one thing that we encourage students to think a lot about, and I would encourage the group here to think about too, is not only why is this problem important to me, but if I need different kinds of resources in order to solve this problem, the people that I'm asking for those resources from, why would this problem matter to them? And not like why should it matter to them, but like legitimately, what is something that they want that solving this problem helps them to get? And thinking, I think all of us are having to think through different kinds of revenue streams, different kinds of resources. And so having to think through, well, who are these new partners? What do they value? And where is the genuine intersection between this problem that I want to see solved and a problem that they really, really care about? And I think, especially in the social impact space, like I'm super guilty of this. The should as the justification is very, very tempting. And I have gotten ignored a lot because I have led with the like, you should care about this. This is important, rather than the like, well, here's the thing I know you already care a whole lot about. And if you help me with this thing, you're going to get something that you really, really care about. And so being entrepreneurial and finding sort of like the value proposition to these different partners so that it becomes like a no-brainer that they want to join in and like participate in this solution.
Well, I love that, Ben. And maybe that we have about 4 minutes, so I do want to be mindful of time. And one final question for the group, and I think it really piggybacks on what you just were saying, Ben, is can we bring this a little bit more back to the practical realities of folks on the call that are alum or students, they're thinking about their jobs, they're thinking about careers, maybe a quick kind of round robin across the group for what you would recommend students and alumni think about and prioritize. If they're interested in tech, if they're interested in this space, if they're interested in social impact, if they're interested in having a broader impact using tech, just some initial or sort of some final thoughts you have on that for the group.
I can go real quick, and it's something,
Yeah, go ahead.
Niles, you and I have talked about, which is I would just encourage people to find people who are also working on stuff. It's very easy to be in a mode of anxiety and lament, which are totally appropriate. But also, yeah, finding other people who are trying to do stuff and hang out with them and be like intentional about being in those kinds of relationships. Because I think those will be less crazy making and will allow people to exercise their own agency. So yeah, I would say find communities of people who are building stuff and hang out with those people.
So if I was to jump in, I would say reading the history of the period before and during major inflection points would be helpful. So, for instance, the Industrial Revolution, the Great Depression, the Great Recession, the software bubble. So, reading that is critical. I also think it's important to learn how to play with large language models and use that to engage with different kinds of data or build simple tools to build your portfolio up. So, one of my students who has never programmed before, in 3 months, she was writing complex Python functions to interact with the ChatGPT API using tools like GitHub Copilot and VS Code. So it's not out of reach for anybody at this point.
Yeah, very accessible. Totally. Yes. Dr. Patrick, any sort of final thoughts on this? Wrap it up.
Yeah, I think part of this, like echoing a little bit of what Ben said and what Justin just said, like I think finding the positive people who want to get stuff done and not being afraid to take the steps forward and like not being overwhelmed by just starting and just kind of like not being afraid to fail and fail fast. Like part of success in anything is getting used to failing, not taking it personally, and just getting right back up and doing the thing again, right? So you're going to fail. And if you're not failing, you're not trying hard enough, right? So I think part of this is be around the people that are supportive, because it's really easy right now to be around folks who are, lamenting, to use Ben's word. But so I think just get started.
Yeah, very good. Well, thank you all. This has been, I love where this conversation went too. Like, I think we were talking a little bit more about some of the research elements and we got into that, but I love this whole conversation about just kind of a mindset, and especially in this environment right now, starting and getting something off the ground and being okay with some early failures, that those are important before 2025. I think they're probably even more important now because this is a landscape where the need to fill in where these gaps are is going to be more important. And I put a message in the chat. We generally, coming out of these sessions, we'll have a recording. We'll send a follow-up email to everyone that registered and attended. But I'm going to push a little bit. And if you'd like to get more directly involved in these conversations, I know Dr. Patrick talked about a 2x2, but just kind of practically thinking about like what else can be done as it relates to public health, Rollins, healthcare, and tech. Would love to get engagement. We're constantly finding ways through the alumni board just to build our community and expand our community. So if you're interested, we'll find a way that you can opt in, and then we'll figure out a way to get you engaged in further conversations. So thank you all who attended. Thank you all to all the panelists and just the amazing work. It is very inspiring, and it's a nice point of optimism to know that you all are leading the charge across Rollins and Emory. And we'll have some follow-up over the next couple of days. So thank you again.
Thank you all. Good day.
Take care.
Bye.